Hello friends, welcome to the new session of Hospital and Clinical Pharmacy. Myself, Miss Malvi Rajendra Bhavsar, M.Pharm in Pharmaceutics. So, today we are going to deal with the chapter Adverse Drug Reaction Part 2. So, let us start with the drug-induced diseases. So, first is drug-induced liver disease. As liver is a major site of metabolism and excretion of drug, it is a common site for adverse effect of drug. Drugs are responsible for 2 to 10% of cases of jaundice and acute hepatitis. The hepatotoxic drugs are classified as drug causing direct liver damage and drug causing liver damage through host hypersensitivity. So first we will start with drug causing direct liver damage. These drugs act as a hepatotoxin due to their specific chemical structure and show predictable dose-dependent liver damage. They may act by causing specific interference in metabolism. For examples of hepatotoxins of these types are isoniazid, methotrexate, tetracycline, methyltestosterone, C77 substitute steroid, and overdose of acetaminophen. Hypersensitivity type hepatic drug reactions. These are the common unpredictable reactions occurring in small fraction of population exposed to the drug. The reactions are not related to dose and onset is delayed. Hepatic injury of this type is associated with other hypersensitivity phenomena like rash, fever, and eosinophilia. This type of liver damage may caused by the drugs like haloethane, phenytoin, sulfonamides, monoamine oxidase inhibitors. This drug causes hepatitis-like hypersensitivity reaction. Anorexia, malaise, fever, and jaundice occur with phenothiazine, chlorpropanamide, hydrochlorothiazide, methyldopa, tricyclic antidepressant, and erythromycin estuate. This following table shows liver disease and the responsible drug for same. So first is acute hepatotoxicity, and responsible drugs are cimetidine, rifampicin, phenylbutazone, methyldopa, erythromycin, halogenated anesthetics. In chronic drug-induced diseases, cirrhosis, and responsible drug is diethylstilbestrol, phospholipidosis, antiarrhythmic drug, vascular injuries, anabolic steroid, alcoholic, anti-cancer drugs. Hepatic granuloma, responsible drugs are sulfonamide, penicillin, allopurinol. Hepatoportal sclerosis, arsenicals, vinyl chloride, vitamin A. Hepatic neoplasms, oral contraceptives and anabolic steroids. Then second is drug-induced renal diseases. Kidney, it is highly sensitive to effect of drug as compared to other organ. This is mainly because of following reasons. So first reason is kidney is highly perfused organ which receives about 25% of cardiac output and get exposed to high concentration of toxin. Drug, when bound to protein, is non-toxic. This drug carrier complex breaks in tubule, liberating the free toxic drug. Precipitation of some drug occurs due to change in urinary pH. Due to the large endothelial surface of kidney, it is prone to deposition of antigen-antibody complex, which may cause hypersensitivity reactions. So, nephrotoxicity and drug responsible for nephrotoxicity are as follows. First is direct glomerular or tubular damage, and responsible drugs are cephalosporin, polymyxins, and aminoglycosides. Nephrogenic diabetes insipidus, responsible drugs are lithium, sulfonylurea, methoxyfluorine. Acute intestinal nephritis, responsible drugs are methicillin, ampicillin, neficillin, phenyltoin, thiazide, and rifampin. Kidney stone crystals, their responsible drug is sulfonamide. Uric acid crystallization, responsible drug is propansil, methotrexate, sulfipyrazone, allopurinol. And renal ischemia, responsible drug is methysergid. Then drug-induced hematological disorder. So the establishment of American Medical Association Committee on the Blood Disorders was concerned with the incidence of aplastic anemia due to chloramphenicol. The expansion of this committee into registry of adverse reaction take place in 1961. So first is aplastic anemia, which is also known as pancytopenia. The drug which causes bone marrow aplasia include alkylating agents, antimetabolites, antibiotics, zinc alkaloid. The antibacterial drug chloramphenicol, phenylbutazone, oxyphenybutazone, and indomethacin are the most common cause of the plastic anemia. Chloramphenicol causes the bone marrow toxicity in two ways. One is by inhibiting the mitochondrial protein synthesis, and other, which is much serious, by causing true bone marrow aplasia, which cannot then agranulocytosis. It is another drug-induced condition due to the destruction of granulocytic leukocytes by antibodies. The condition may happen due to toxic depression of bone marrow stem cells after prolonged administration of drug in large doses. Drugs which induce agranulocytosis include sulfonamide, sulfonylurea, phenothiazine, anti-thyroid hormone drugs, phenylbutazone and semigeneric penicillin, anti-tubercular drugs. Thrombocytopenia. The reduction in the count of thrombocytosis is due to the bone marrow suppression and the destruction of platelet. The cytotoxic drug like chloramphenicol, sulfonamide, phenothiazine, antiepileptic causes the bone marrow suppression. The drug which forms the immune complexes that destroy platelet are quinidine, aspirin, methyl-dopa, cardiotonics, and acetazolamide. Then comes hemolytic anemia. It may occur due to genetic abnormality or acquired immunological abnormality. Hemolysis occurs in patients with deficiency of glucose 6-phosphate dehydrogenase. The immune hemolytic reaction takes place with the methyl-dopa, levodopa, mefenamic acid, and streptomycin. This drug binds to the protein in the RBC and causes hemolysis. Then drug-induced gastrointestinal disorder. Most of the drugs are taken orally, hence there is a maximum possibility of GIT disorders. Common adverse drug reactions include nausea, vomiting, constipation, anorexia, and ulceration, including dyspepsia, ulceration, sometimes GI hemorrhage, and pancreatitis may also occur. So, adverse drug reactions and causative drugs. So, first for nausea and vomiting, most frequent, all orally administered drugs are responsible. Dysgenesia, that is altered taste sensation. It is due to the penicillamine, metronidazole, levodopa, captopril. Dyspepsia and ulceration of gastric mucosa occurs generally due to non-steroidal anti-inflammatory drug. Constipation, responsibility due to morphine, hematinics, nifedipine, antihistaminics, etc. GI hemorrhage generally occurs due to corticosteroid. Ulceration in small intestine occurs due to potassium chloride tablets, which are enteric-coated, and diarrhea and colitis due to antibiotic, especially lincomycin, chloramphenicol, neomycin, and other antibiotics, and cholinergic. And drug-induced pulmonary disorder. The most common drug-induced disorder of lungs are bronchoconstriction and asthma. Aspirin and NSAIDs inhibit prostaglandin synthesis. Penicillin is most common drug causing allergic bronchoconstriction. The other antibiotics include streptomycins, chloramphenicol, tetracycline, and erythromycin. The long-term use of busulfan, that is a toxic drug for leukemia, nitrofurantoin, and bleomycin causes pulmonary toxicity. The symptoms include cough, dyspnea, and fever. Pulmonary fibrosis also occurs. Drugs such as beta-adrenoreceptor agonist and antagonist causes acute asthma. The excessive dose of aminoglycoside antibiotic causes paralysis of respiratory muscles due to muscular blockade. Drug-induced skin disorders. Skin is most sensitive organ of the body, and about 1/3 of all the reported adverse drug reaction involves skin. So, toxic eruption, that is alopecia, due to bromides, allopurinol, methyl-dopa, chloroquine, etc. Allergic reactions include first eczema due to allopurinol warfarin, erythema multiforme due to penicillin or barbiturates, erythema nodosum due to sulfonamides, Stevens-Johnson syndrome due to sulfonamide, phenobarbital, and penicillin. Toxic epidermal necrolysis or Lyell syndrome occurs due to phenolphthalein sulfonamide. Hirsutism, which occurs due to corticosteroid, long-term phenytoin, and systemic lupus erythematosus, which generally occur to sulfonamide, glycophyllin, and hydrazoline. The drug-induced ocular toxicity. The most common drug causing ocular toxicity includes phenothiazine, anti-malarial, that is chloroquine, anti-arrhythmic, amiodarone, and corticosteroids. So these are the adverse effects which generally occur due to the drug, like corneal ulceration due to decreased tear production, pigmentary retinal damage, glaucoma, cataract, and optic neuritis, as well as amblyopia. And these are the causative drugs which are responsible for this adverse reaction. Drug-induced neurotoxicity. The adverse drug reaction are causing damage to nervous system. There are two types: extrapyramidal reactions and myasthenia-like reactions. So, extrapyramidal reaction occur due to phenothiazine, reserpine, methyldopamine, haloperidol, whereas myasthenia-like reactions occur due to aminoglycoside, antibiotic, trimethadione, and cholecystine. And drug-induced ocular toxicity. Ototoxicity due to two types, which is vestibular toxicity and cochlear toxicity, affect the vestibular and cochlear of internal ear respectively. The vestibular toxicity resulting in impairment of balance of body, whereas cochlear toxicity resulting in permanent loss of hearing. And the causative drug or responsible drug for vestibular toxicity include streptomycin, minocycline, and tetracyclines. Aminoglycoside antibiotics such as neomycin, streptomycin, gentamicin, amikacin are the most ototoxic drug, causing permanent damage. This drug destroys the outer hair in the spiral organ of corticosteroid. There are diuretics such as furosemide and etheric acid. It also causes ototoxic in patient and with renal failure. Tinnitus and bilateral hearing loss may also occur in patients treated with salicylate. This hearing loss is reversible. Then teratogenicity. Chemical agent can affect somatic cells of developing embryo in such a way that defect produced in one or another organ system. This drug or other factor producing deviation or abnormalities in development of embryo that are compatible with prenatal life and are observable postnatally are called as teratogens. True teratogens causes abnormality in dose lower than the necessary to cause effect on the mother or a fetus. It is most harmful if the fetus is exposed to drug during the first 10 to 12 weeks of gestation. During gestation, there is increase in plasma protein which bind drugs poorly, resulting in the more free drug. Then thalidomide, which is tranquilizer and hypnotic when given in small dose only on one or two occasions between the 4th and 7th week of pregnancy, resulting in infant born with phocomelia, a shortening or complete absence of limbs. Other teratogenic agents are androgen folate antagonists like methotrexate, diethylstilbestrol, tetracycline, busulfan, cyclophosphamide, etc. Diethylstilbestrol, a synthetic estrogen, was used to prevent the threatened abortion. If the mother receives diethylstilbestrol in the first trimester of pregnancy, a time when the fetal reproductive system is developing, the female offspring that will born may develop vaginal adenocarcinoma in teenage. A single teratogen can produce multiple malformation, and single malformation may be induced by number of teratogens. Then some important teratogenic principles. First is specificity. It may be teratogenic to one species but not another. Example, thalidomide is teratogenic to rabbit and humans but not rat. Timing exposure. Depending on the stage of development of drug that may show different adverse effect or even no effect. Same example is thalidomide that was taken on 21st and 22nd day of gestation. Absence of external ear and paralysis of cranial nerve resulted. And then when it was taken between 24th and 27th day of, the phocomelia effect is maximum, affecting the principally the arms. And when taken day or two later, similar defect of the legs occurred. This sensitive period terminates after 34 to 36 days of gestation. Genotypes of mother and fetus susceptibility to teratogens is also affected by genetic factor like fetus with deficiency of epoxide hydrolase enzyme may cause penitent toxicity and fetal Hydantoin syndrome. Simultaneous drug exposure, folic acid antagonists such as sulfonamide increase the incidence of cortisol-induced facial cleft in the mice. Thank you. Thank you very much for listening. Thank you so much.